right, awesome. So next slide. Cool, so welcome everybody. This is the occupational therapy briefing. I'm Master Sergeant Laura Arnold, been in the Air Force for 18 years and have been Officer Sessions Recruiter for about 3 years now. Before this, I worked at the MEPS, Military Entrance Processing Station. And before that, I did my enlisted recruiting assignment in Florida. But yeah, that's a little bit about me. And then with me, I have Sergeant Rivera.
Hi, everyone. I've also done enlisted recruiting. I was stationed prior to that in Dover, Delaware, flying missions on C-5 aircraft. But since my enlisted recruiting time, I've now transitioned to Officer Sessions Recruiting, hence why I'm going to be here for today's briefing.
And then also on the line, we have Major Turner, who's actually an occupational therapist. So we appreciate her being here and her expertise. And then, ma'am, if you wanted to give a little spiel about yourself before we get started here, you're more than welcome.
Hi, I'm Jessica. I'm an occupational therapist. I currently work at a skilled nursing facility, and I'm relatively new. Have less than a year experience. And I have experience in working with pediatrics.
My audio is cutting out. I think you want me to give you a little of my background. I've been an occupational therapist though for 10 years, and I did a year as an OT before coming back into the Air Force though.
Okay,
Sergeant
awesome.
Arnold, can you hear me?
Yes, awesome. Thank you so much. Cool, so we're gonna get started. Basically for today's agenda, we're gonna go over eligibility requirements, position description, advantages to being an occupational therapist in the Air Force, training and professional growth, Air Force benefits, what your next steps are, and to go over any questions you guys might have. Cool, so eligibility requirements for occupational therapy in the Air Force is you have to pass the military physical, which is just like a doctor's phys. You must be a US citizen. Age cutoff is 42 years old. And then completion of an accreditation council on occupational therapy education. And then must possess national board certification in occupational therapy through the National Board for Certification in Occupational Therapy, NBCOT, as occupational therapist registered, and possess a current unrestricted state license by the time that you actually assess into the Air Force. Next slide.
So this is some of the position descriptions that we have. Air Force occupational therapists evaluate and treat active duty members of the armed forces, family members, and retirees with a variety of physical, sociological, or developmental limitations. Therapeutic treatment plans are directed towards the promotion of health or rehabilitation of physical, cognitive, and psychosocial function as they relate to the activities of daily living and instrumental activities of daily living. Specific areas include evaluation and treatment of patients referred for a wide variety of diagnoses who require acute rehabilitation in both inpatient and outpatient settings. In addition to managing educational and research functions, duties include administering occupational therapy programs, making recommendations on staffing, physical plant designs, equipment and supply acquisitions, and advising commanders on long-range planning and program development needs in support of occupational therapist services. Major, would you like to elaborate a little bit on any of these topics that we previously mentioned here within the overall job descriptions?
Sure, can you hear me now? Because earlier I was trying to talk and I don't think you could hear me.
Perfect, you sound crystal clear.
Can you hear me?
Yep.
Okay, great. So to elaborate on these areas, so it depends on which base that you're at, which we can talk about more when we get to specific bases that OTs are at. So you would be more likely engaged with cognitive or psychosocial, those areas of expertise whenever you are at bases where you've got MTBI patients. So some bases are going to be upper extremity heavy compared to your cognitive psychosocial. So it just depends on which base that you're at.
Awesome. Thank you.
All right, so some of the advantages to become or being an occupational therapist in the Air Force are all listed here. So paid CMEs, no overhead costs, no lease, no payroll, no people to hire or train, no equipment to buy or maintain, is a ready-made clinic, established patient base, no malpractice insurance, licensure is good in all states. And then you also have the opportunity to work in small, medium, and large clinical settings. Your salary is going to be comparative to the outside, as well as access to excellent colleague consultations on a daily basis. Even if it's not on the same base, you'll always have the opportunity to reach out to another colleague, maybe on another base. And then educated and loyal patient base that will follow your treatment plans, and no overhead expenditures. So some more benefits to becoming part of the Air Force is you guys are going to start off with an excellent starting salary, which includes regular pay raises and promotions. You get 30 days of vacation that's paid for each year. Continuing education opportunities, tax-free housing and food allowances, comprehensive medical and dental care, opportunities to live, work, and travel worldwide, and generous retirement program.
As an Air Force occupational therapist, you'll be a member of the Biomedical Science Corps. BSc is what the term that we commonly use for recruiting, and also a highly respected member of the world's premier healthcare teams. So you will enter active duty and attend an 8-week commissioned officer training program at Maxwell Air Force Base, Alabama. This course is aligned in a 4-phase approach: orientation, development, application, and transition. So for this, you can also follow them on Facebook at Air University to help highlight some of the officer training school events that go on throughout your 8 weeks, if you'd like to look into that a little bit further.
All right, and then so basically the next steps in this process, if you are interested, we do have to go over, an initial appointment with you, make sure that you're qualified for the Air Force in general. And then we would need all of these documents in order to get you into the Air Force system. Once we do that, we're going to send you to a pre-processor who's going to be able to get you scheduled for your medical clearance physical, which will happen at a military entrance processing station that's local to you. So after that, you'll go ahead and you'll complete your application once you're physically qualified, and that'll be turned in for the board to review. Once they select you, then you'll be moved over to post-processing, who's going to help you with all of your commissioning documents and getting you prepared for OTS. And then over on the side here, you'll see important dates. So we do have cutoffs for you guys in the board schedule. So basically, the interview cutoffs for you all is going to be for February 22. Application cutoff, which means that you have to have letters of recommendation completed, your MEPS physical completed, your interviews completed, and your actual application completed by 11 February. So that way the board can meet on 22 February and decide if you're a qualified candidate or not. And that release date to let you know if you're selected or not will be released on 11 March.
So if you have further information here in just a moment, we're going to hold a brief Q&A session. And if you have other questions you think of after this meeting today, please feel free to email us at the email address listed here. If you would like to, find out more information or simply obtain some of the information we've already presented here on these slides, we can also send that over to you.
Okay, cool. So just to go over any questions, do you guys have anything for us or for Major Turner? Okay, cool. So Major Turner, I do have some questions that came from the field that we typically get. So just the first one is like, what does your typical day look like as an Air Force occupational therapist?
Yeah, so your typical day at most bases are pretty upper extremity heavy. So you have a caseload usually between 8 anywhere to 15 patients per day, upper extremity rehab, and some of our larger MTFs as well. We also have an inpatient caseload. So you'll have a mix of your hand therapy patients and also some inpatients for discharge placement, ADL retraining. And like I said, it varies base to base on what your population will look like. But your typical day, most bases, it's upper extremity is your bread and butter. That's a majority of your day.
Okay, great. So I know you talked about the upper extremity, but what about like, what exactly does your patient load look like? Is it more active duty? Is it retirees or?
Yeah, and it just depends. So active duty is always our priority because, mission capable, keeping active duty ready to deploy. But when we have availability, we also see dependents of active duty. And then we also see retirees and dependents of retirees as well. In addition to sometimes also seeing VA patients, because a lot of the larger MTFs we work at will have like a joint relationship between VA and our MTFs for OT, which isn't always provided by the VA. So the majority of your population day to day is active duty, but you still get to help families and retirees as well. Yes.
Okay, awesome. So I do have another question that came from the field just recently. Is hand therapy, like coming in as a qualified hand therapist, something that the Air Force is looking for, or is that something that they would learn once they come into the Air Force as like a CME or something?
Well, so as OTs, we're always learning. So it's not a requirement to have a CHT. Of course, it's very helpful to already have a good solid background, even if that was just a field work level 2 experience in a hand rotation. So just being familiar with your precautions and making splints. You don't have to necessarily be a guru at making splints. That comes with time, but just having that level of comfort to do hand therapy and know that you're always learning. Yeah, we're not going to throw you to the wolves. Most places where we do have hand therapy clinics, you've got more than one therapist. You'll be with someone who has been in the field for a while and is quite experienced, because most of those places we do work pretty close with hand surgeons. So you're going to get a lot of hands on from those post-op referrals for hand therapy. So no, you don't necessarily have to be an expert or have a certification, be a CHT in hand therapy, before you come in and go to a base that's pretty hand heavy.
Okay, got it. Thank you. Um,
Can you hear me?
yeah. And then as an occupational therapist, how often would you deploy?
Well, that varies. So I deployed 2 years ago, but it wasn't as an OT because you don't just have opportunities to deploy in your AFSC. Other opportunities come up as well, career broadening. So I deployed as an executive officer. We currently have an OT that's deployed now as an XP for programs. But when we deploy as OTs, we support hands, of course, that mission in addition to post-concussive care.
Okay,
So they're not often, we don't deploy often, but there are opportunities there.
gotcha. So is it like a sign up list where it's first come, first serve for opportunities, or it's just luck of the draw?
It depends on what base you're at. So I'm here at Nellis. We have a higher, ops tempo for deployment. So it just depends where you're at and what opportunities, come down to that base. And yeah, you can put your name in the hat. If you want to deploy, there's opportunities. You just let your leadership know that you want to have your name put in the hat.
Understood. Thank you. And then last question that I typically get from the field is, do OTs in the Air Force often get to do like humanitarian missions?
Well, I know BSCs, those opportunities come around for us as a whole. I don't know any Air Force OTs who personally have gone on a humanitarian mission yet, but those opportunities do arise as well. Not very often, but they're always out there.
Awesome. Cool. So if nobody else has questions that they want to ask now, we're going to go ahead and end the recording, and then we'll talk after, if that's okay, and then we'll jump off here.
We did have one more that came in from the field recently. I wanted to bring up is why did you join the Air Force for your profession, and why have you stayed?
Well, that's a good question. I hope you could hear me earlier that I'm prior enlisted. So I came in with the sole intent the first time of just getting a GI Bill. So I did the one enlistment, got out. And even when I first got out, I didn't even know what I wanted to use my GI Bill for. And I met this friend of a friend who was always happy with her job, and I was like, I want to be her. And I asked her one day, what do you do? What is that job that you're always so happy about? And so she told me, she said, I'm an occupational therapist, and she was working home health. And then she explained that she helped people stay independent, stay in their homes longer, improve quality of life. And that hit me. That's what I want to go to school for. That's what I want to use my GI Bill for. I want to be as happy as her every day. So I pursued that. I used my GI Bill, got my OTD degree, and then I realized, I can make a bigger difference than just my small community, and have the opportunity to go back into the Air Force, because truthfully, I always missed the Air Force. It's a very unique family. Once you're part of the Air Force, your family expands, it grows. It's hard to explain till you've been there, but always missed that and Air Force life. And so I was like, how great would that be to not only have the best job in the world, to be an occupational therapist, but to also be an Air Force OT. So I pursued it. Thankfully, it worked out. I came back in 2012, hit the ground running, and it seems like yesterday. So time flies by for us. We are at each duty location for about 3 years, and seems like about the time you're really getting used to one clinic, it's time to move on to another opportunity. So there's always these just great potentials for growth, and then expanding and meeting new people and having different opportunities. So I think that's what has kept me in, kept most of us in, is we always are encouraged to grow and expand your knowledge base, and you have these unique opportunities too to provide mentorship constantly. Every day when you even interact with your coworkers, you're constantly mentoring. And I even find myself with patients, I have unique opportunities to mentor, especially as an OT, because we look at the big picture quality of life. Sometimes those factors come up to where patients need a little more psychosocial encouragement as well. So, like I said, being an Air Force OT, honestly, being an occupational therapist really is the best job in the world. And being in the Air Force is one of the greatest opportunities also. So to have that combined is really, I'm living the dream. We really are. I mean, it's fun every day to get to put on the uniform, come to work, set goals for myself, meet them, help other people set goals for themselves. And I'm not just talking about patient care, because we do that daily. We set goals, help those patients meet those goals, but also too your coworkers and people that you work with. We're always trying to build each other up, and you're always training that next generation of people who are going to replace you, and knowing that that legacy lives on. So it's just a unique opportunity to you've lived it. It's really hard to explain it, but it's great. And that's what's kept me in all of those.
Awesome. Cool. All right, so we're going to stop the recording now, but thank you so much for joining us, Major Turner, and everybody that's on the line. And then stay on if you have any further questions.
I just would like to tell people what bases we're at if they want to hear.
Yeah. Go ahead.
Because with this being a smaller career field, we have some really great bases that we're at. It's just not as big of a pool, but there's some really great opportunities to work in some really great MTF. So if folks want to hear that, I'll share the 12 bases that we're currently at.
Yeah, of course. Go for it.
Okay, so we're at Andrews, that's one of our bases, and then Elmendorf, which is Joint Base Elmendorf-Richardson in Alaska. We're at Keesler, San Antonio, Nellis, of course, that's where I'm currently stationed at. Spangdahlem and Lakenheath, those are 2 overseas assignments, and that opens up EDIS opportunities, which is working with pediatrics early intervention. And did I say Eglin, Travis, there's the Academy, and Kirtland, and Wright Pat in Ohio. Yeah, so some great opportunities there. And like I was explaining earlier too, each base that you go at, one might be a little more hand therapy heavy, one might be a little more MTBI, cognitive therapy CAP program, which is our computer assistant program heavy. And then the ones that I talked to too, the 2 overseas assignments, which are the EDIS pediatric rotation opportunities. So if you get bored at one location, just know in 3 years you're moving to a different location. It could look completely different. Your day could. Yeah, so just great opportunities out there.
Awesome. Very cool. Thanks for sharing that.